Thank you. This declaration of public health emergency enables the Department of Health and the Director of Health to take any action that would be necessary to address this public health emergency. Provides me the powers that are outlined here, and this has been done in conjunction with our Department of Legal and other, including the Mayor's Office, as well as all board members. I'm happy to answer any specific questions about it.
Sure. I open the floor up to my fellow board members. Any questions or discussion? I would entertain a motion for approval.
Well, actually, I thought that was just for questions. So I do have about what our authority is. I do have a couple of questions.
Of course.
About the way it's worded and what this actually means, because there are a couple of things that are vague to me.
Please.
Section 4, are we empowering the Director of Health to take any of those actions with this resolution, or are we only empowering him specifically to enact Section 5?
We are authorizing Director Caldwell to take any actions that he deems necessary to protect the health of our community, including Section 5.
Okay. All right. And within Section 5, it specifies here that any facility that's licensed to serve food or beverage whose primary business is alcohol service over 50%, which I assume is the designation between a bar versus a restaurant, I assume that that's the designation, is to be closed. I was speaking to owners of some venues who provide primarily entertainment. And does closed mean closed to the public? Or does closed mean, or could they have, for example, could their entertainers put on an online show to benefit the employees? Because I'm concerned that the people who work in the hospitality industry are going to be harmed by this. I understand the public health concern and do want to make sure we take care of that.
I will defer that authority based on this will be given to Dr. Caldwell to determine that exact question.
Okay. Does it mean closed to the public, or does it mean that no one can be there, period?
I look at the purpose of this declaration is to empower the Director of Health to dive in to make all of these decisions. I think that while some decisions are clear of what we're doing today, the authority enables these actions to address all venues. And the intent is to assure that we have what has been called social distance, but I'd like to call it physical distance, because we need to maintain the social fabric as best we can. But we need to maintain that physical distance, and that's specifically what's being addressed here as outlined with some of the businesses that are listed. I think the overall public health emergency is to provide me that authority that as I identify other specific businesses and organizations that need to be specifically addressed, I can do that.
Thank you.
Just a follow-up question. What type of scenario would precipitate you making that decision? So I would assume that after this meeting, you may not make that decision right away, but maybe in a few days you might. What are we looking for in terms of you actually saying, okay, I'm going to move forward with making a decision to close a facility on a particular facility?
Yes. I think they need to be defined about what exactly is going on. What is the normal operating of that business and what's happening in that facility? And it will allow me to specifically address the conduct of the interactions of the public at a particular public facility in order to assure that they're meeting the intent of this public health emergency, which is to reduce dramatically people being within 6 feet of each other.
And I will say, if I may, one thing that I, as board chair, will ask you if this resolution passes in coordination with Mayor Cooper's request of us to look at public health is to, if you are instilled these powers, is to close bars that have revenue, bars in Davidson County, and decrease the occupancy of restaurants to 50% of occupancy or 100 patrons, whichever is less. I think that is an initial important first step. And I implore you that if this resolution is granted to you, that is conducted immediately.
Yes, I believe that given the nature of most of the businesses that are visible within Nashville with the bars and the restaurants, that has been the major focus of this particular public health emergency. However, this is broader to enable the Director of Public Health to make sure that we are not missing other specific venues and that action can be taken appropriately.
Ms. Harrison.
And how does this get enforced, actually? What's the protocol?
Immediately, I have a meeting with our Director of Environmental Health. I'll be talking to our Chief of Police, Anderson, and Chief Swan to think of a number of enforcement actions that are appropriate that would be able, number one, to educate the community about specifically what we're asking them to do, to get the word out, and to make sure and identify that people are being compliant with that. So the specifics are not identified yet, but it will be through primarily my Director of Environmental Health Services, who permits a lot of these facilities, although not all of the facilities.
Any other discussion? Dr. Johnson.
Thank you for your hard work on this. I was just wondering, there are other cities that have been severely affected. Is this a model that we used from other cities?
Things are moving very rapidly, and I would say that I feel confident that this particular declaration provides me the latitude to be able to address the emergency as I need. I will continue to provide specific recommendations to the board and ask for your advice. However, I believe this particular declaration would suffice in order for me to act in whatever way I need to act in order to protect the public.
And Dr. Johnson, I will say, just within the past few hours, I believe the city of Chicago has implemented almost similar restrictions on restaurants and bars. I know the District of Columbia over the past few hours, Boston, New Orleans. I think they're all very similar. I don't know the exact details of their rules, but I know they're very similar. Again, an attempt for our leaders and as city leaders for us to flatten the curve and minimize the impact of this virus. So yes, I think this is very similar in line with those other cities.
Thank you.
So the meetings that you spoke of with the other city officials who obviously are going to be really important through this, will they be taking place quickly? I'm just concerned about all the workforces
Yes.
of these different entities, especially the
Yes.
health department.
Yes, absolutely. As soon as this is passed, we're going to make sure that we can enact an enforcement policy.
Dr. Campbell, excuse me.
I just wanted to kind of an update down the causal chain that we're trying to prevent, having read about the tragic situation in Italy where physicians are having to make decisions about who's going to die because they don't have enough respirators, intensive care units because of the exponential curve of too many people getting the illness at one time. What is the situation in Nashville about ICU beds and respirators, and how we do it?
Sure. So I'll speak as to the past several days as the director of the task force that the mayor implemented. From the first second, and actually maybe a day before the first second this happened, we were having very close communications with every hospital system. The CEOs of every hospital, the CMOs of every hospital system have been involved in meetings with us. Just this morning, I created an ICU task force of leaders from every one of our major hospitals to, on a regular basis, communicate with me. And by regular, I mean, if need be, hourly. We've shared emails and phone numbers this morning because I, too, believe that the surge on our hospital system is an important thing that we need to mitigate. I think this power to Dr. Caldwell is an important step to do that. As of right now, I feel very comfortable from my discussions with Nashville General, with the Vanderbilt University Medical Center system, the Ascension system, and HCA system that our city can tolerate what we have in case of as far as patients. But again, what we need to do is minimize this surge that may happen. It's not just the patients who have this disease. It is people who have heart attacks, people who have trauma, people who have cancer. We need to make sure our great hospital systems that we have in the system can tolerate that. And that is why I think this action and perhaps others in the future that will mitigate the disease burden on our city is really important to implement.
I have a question, but it's not about the resolution. Are we going to have time for, or maybe I should just go ahead and ask, because it still has to do with some of our vulnerable populations.
Sure.
Particularly those individuals, when we think about health outcomes, we know which segments of the population have the worst health disparities, and those are the individuals that are most likely to have underlying conditions. That same demographic are the ones that are going to be taking buses, that are responsible for, that are going to be working in restaurants, responsible for some of our housekeeping scenarios at MMPS and other buildings. What guidance is being provided, particularly for individuals taking the bus, or bus drivers, and also for individuals that are still going to have to report to duty, cleaning buildings and so forth and so on? And I don't know if Dr. Wright might.
We've already been out and met with the bus system. We are developing guidelines as quickly as we can, but I would expect that there will be some guidelines out on our website as quick as tomorrow regarding all of this type of stuff. We do realize that there are a lot of different professions and pieces, businesses and individuals that all of this affects, and we're having to think through all those processes, and as we get those developed, we'll be pushing those out as quickly as we can.
Okay. Thank you.
Any other questions?
Just one final thing. I'm sorry.
No, please.
In relation to, I had a question earlier about the definition of closing. I would just like to ask you that that we not make that closing so restricted that if a person could work in a place that happened to be a bar without the public being there, I don't know, but they need to come in and clean the place. I mean, are we making it so prescriptive that no one can actually work, that no one can be there, or that the public can't be there? I know that's not for this resolution, but this is just when you start enforcing and that sort of thing, so that you don't have a lot of questions about what does this really mean, because it's not quite clear.
If you look at Section 5 specifically, that is one part of this public health emergency declaration that is specifically directed to those facilities. That seems to be the highest priority, that any facility licensed to serve food or beverages and to direct those whose primary service is alcohol services to close.
I guess my question is that if someone can come in and still get a paycheck, but they're not having to interface with the public, and I don't know what sort of job that would be. Maybe a bookkeeper works there, a housekeeper. I just want to be sure that we know what the definition of closed means.
So I believe my understanding of what will be the best impact on public health is to prevent patrons.
Okay.
I believe also, knowing that the business community that we've spoken to that supported this, they will want to perhaps in this opportunity that the bars are empty to clean the facilities, to make sure that they are doing their part to clean the surfaces and other things where this virus could live. I would be extremely, and I assume Dr. Caldwell with his public health experience would probably agree with me, I don't want to speak on your behalf, that of course should be an important component, that individuals that can go in, that can work, they can also do the public health service of cleaning the facilities. I would think that, I don't believe this resolution would prohibit that, is my opinion.
Okay, I just wanted to clarify.
I just, because we do have an audience here, we don't normally have an audience at our meetings, but we do today, and I'm glad. But what I'm wondering if Dr. Caldwell, you can also maybe speak to what this means for small business owners of restaurants, particularly those that are preparing meals for takeout, or how do we envision this might impact them, or will they be okay to stay in business and still serve their customers? So I'm thinking about some of our meet and greets and
I am.
so forth
I'm thinking
and so
about
on.
them too. And
Yeah.
our director of environmental health services, our environmental staff that permit these facilities primarily. And remember, this provides me the authority to handle the entire community, whether we already have a relationship with them or not. Nobody's going to be alone. These are everyone who works in our community is a member of our community. They're our family, they're our friends. we are going to provide them as much support and guidance as we possibly can. We want to have the intent of this declaration to be fulfilled, and we're going to work with every single entity to assure that we can provide them as much support as we can while fulfilling this intent. It's going to take a tremendous effort, and we're going to need a lot of help to fulfill this. But I agree that we want to assure that we reduce the amount of people who are interacting with each other, reduce the amount of space or expand the amount of space that is between them as much as possible. And if we can work with particular facilities on accommodation, there's no question that I'm going to be very interested in trying to provide those accommodations.
And I would say my understanding of this declaration, this does not prohibit, I think you mentioned it so great, I'm glad you mentioned this, is takeout, right? I think all this is for restaurants is to minimize or decrease the occupancy to 50% of current or 100 people. So this may, if a business can have an opportunity to increase their takeout business, their I'll say Uber Eats or Postmates or whichever one of those companies you like. This, by my interpretation, by no means restricts that. It just minimizes the number of patrons. So that's a really great point to highlight. Dr. Johnson.
This is not on the agenda, but will this advance to concerns about daycares and food preparation in schools?
Can you repeat your question? I don't think I understand.
Schools are closing or having modified days.
Yes.
What about preschool daycares, centers that prepare meals
Yeah.
for children? Will this have any impact on those kitchens?
No, this particular act will not, but it will provide me the authority to have the flexibility to make any decision that I believe is within keeping with the intent of this declaration. So at the first moment, this is to address the crowds that we see in the bar environment and in large restaurants. We want to immediately reduce those crowd sizes. This declaration gives me further authority to address the entire community wherever I may see crowd sizes. So if their daycares are open, we are going to want to make sure that they are fulfilling the intent of this by hopefully, as best as possible, providing a reduction in maybe the number of children in a particular room or the amount of spacing, and to assure that the food provisions are also adequate for them. So, you're bringing up a lot of really great questions, and they're going to continue to be questions and parts of the community that we need to think about, and every single one I'm going to do my best to address as individually as possible.
Are we ready to, I'd like to make a motion to accept the resolution.
Motion to accept the resolution by Dr. Campbell. Do I have a second?
Second.
Any other discussion regarding this? All in favor? Aye. Any opposed? Abstentions? Motion carries. Any other business? If not, I adjourn this meeting of the board. Thank you.
And Dr. Conger, who is our board chair, will be available for comment and just a few questions. I'm going down.